Welcome back. A new forecast tonight from the CDC projects that by the 22nd of August, a little more than 3 weeks from now, the COVID death toll in the country will top 173,000, 20,000 more. It comes at the end of another day of more than 1,000 fatalities, and Florida surpassing its daily high for the fourth straight day. Set against that grim news is a number of promising developments, we should note, in both treating and preventing the disease. We're going to speak about that in a moment. First, a report from CNN's Elizabeth Cohen.
The medical profession is getting smarter every week, and eventually they'll be armed with amazing therapeutics.
That's philanthropist Bill Gates on CNN's Global Town Hall Coronavirus Facts and Fears. The Bill and Melinda Gates Foundation and its partners are funding up to $125 million in research for coronavirus treatments. For now, doctors are mostly using treatments that already exist for other diseases. Studies show blood thinners help fight clots that are common among COVID patients, and steroids reduce the risk of dying from COVID-19. And preliminary unpublished data shows that receiving convalescent plasma or blood from someone who's recovered from coronavirus also reduces the risk of dying. As far as new weapons against COVID-19, there's just one approved treatment, remdesivir. A study published in May shows this antiviral drug shaves 4 days off a hospital stay. While that's helpful, it's not nearly enough. There's still a need for more new coronavirus treatments.
I think that therapeutics is actually the most promising thing, and not talked about as much as the vaccines, because if you have multiple therapeutics that between them are reducing the death rate and the amount of serious sickness by over 80%, probably over 90%, that does start to reduce the horrific burden.
And there are many in the pipeline. Dr. Francis Collins is director of the National Institutes of Health.
Most exciting for therapeutics, in my view, the use of monoclonal antibodies derived from people who have survived COVID-19, who have made these antibodies to help them recover, and those can now be turned into products.
Dozens of companies are developing these drugs they call the strongest antibodies that fight off COVID-19. Some look so promising that they're already in phase 3 testing on coronavirus patients, like Jennifer Burnt, an Arizona nurse who got infected.
I've seen people sick from this virus. I've had a friend struggle for his life with this virus. I've had patients in the hospital who are scared because their family can't be there at an awful time in their life.
Earlier this month, the federal government awarded Regeneron $450 million to fast-track its development and manufacturing.
They say they could have up to 70 to 300,000 vials of this by the end of the summer or early fall.
A different approach? Antiviral drugs that directly attack the virus. And researchers are also studying drugs that affect the virus's RNA, its actual genetic material. These approaches are leading to new insights about how we combat the virus so that while we wait for a vaccine, and perhaps even after, doctors can help patients with COVID-19. Elizabeth Cohen, CNN, reporting.
Some promising signs there. So perspective now from public health expert and former Harvard professor William Haseltine. He now chairs Access Health International. He's also author of A Family Guide to COVID, Questions and Answers for Parents, Grandparents, and Children. I'm sure a lot of folks would gain a lot from reading that. Professor, thanks for coming on. You heard Bill Gates say there that in his view, therapeutics could be just as important as a vaccine to controlling this outbreak. I wonder, do you agree?
I definitely agree. I'm a veteran of the AIDS wars. I came up with a theory of combination chemotherapy for HIV, and it's in the absence of a vaccine, it's done wonders. People who would have died are alive and are alive for decades. And we can do the same for this virus. I think if I were a betting person, I would bet 95% on drugs and 50% on vaccines as being the most effective way to handle this disease. We can make drugs that not only treat and cure people, we can have drugs that prevent infection, just like we now have for HIV. Drugs that prevent infection.
Yeah, it's interesting because as you know yourself well, that's a disease that there never was a vaccine developed for it. So of these methods so far, is there one that you find particularly promising?
I think that the monoclonal antibodies will be the first. There's advantages and disadvantages. They're expensive to make. They have to be given intravenously. The virus gets resistant to them relatively quickly. I'm actually more in favor of small chemical drugs that work to inhibit the processes the virus absolutely needs. That's what's worked for HIV, and I think that will work for many other viruses. There's another respiratory virus, respiratory syncytial virus, that babies get, and it helps them. So I think there are many, many things that we can do, and are now doing, and that's coming soon.
So let's talk about vaccines. You heard the head of the so-called Operation Warp Speed say he expects a vaccine to be as effective as 90%. Dr. Fauci injecting a little bit of skepticism about that, but even he has said workable vaccine possibly by the end of this year. Are you as hopeful?
I think we'll have a vaccine. How well it works and how safe it is going to be the big questions. But Dr. Slawi should know better. He's worked for 30 years on problems like HIV and malaria, where we don't have answers. He doesn't know as much as he may think he does about this virus. You should never try to bet against nature. Coronaviruses are tricky. They reinfect people every year, the same cold viruses. This is a coronavirus. It's like a cold virus. You can't underestimate how tricky it is. And that's why my bet is not 100%, and it's not even 90%. Like Dr. Slawi's. I would say it's somewhere like 50%, given how complex these infections are. These are complex infections.
Yes, smart to be skeptical throughout. Finally, just very quickly, do you believe this country can reliably get a vaccine to all the people who need it when it comes out?
You know, that is a big question. We've seen the massive failures on testing, which you've talked about earlier in the program. We've seen the massive problems with getting a country to work as one, which we will need. You know, getting a vaccine to people, especially in these times where there's a lot of anti-vaxxers, and our president was an anti-vaxxer, is going to be tricky. You've got to use care and persuasion, not the strongest tools in the toolbox today.
Well, let's hope we get there. William Haseltine, thanks very much.
You're welcome. Thank you.